employment benefits, and the eviction moratorium. To get started, we're going to talk with Public Health, Seattle and King County. Laura?
So heading into the winter and with the recent extension of the restrictions on gatherings until at least January 4th, 2021, we're seeing a real toll on our mental health. And it's hard to focus on supporting our communities when we're feeling stressed and anxious and distracted. So instead of our regular conversation on COVID-19 numbers, we're bringing on Public Health Seattle and King County to chat with them about what they're doing to help folks cope with stress of COVID-19 and all of the impacts related to the pandemic.
So tonight we have Anthony Rivers here with us, who is the Community Wellbeing Program Manager with Public Health Seattle King County. Hi, Anthony. Great to meet you.
Thank you. Thanks for having me.
So as we're talking with Anthony tonight, please add any questions to the chat and we'll try to get to them during the Q&A session. So Anthony, you're the Community Wellbeing Manager. What does community well-being mean to you and what does your work entail exactly?
So community well-being to me, you can hear me okay?
Yep, we can hear you.
Okay. Community well-being is, by definition, it's this long drawn out academic bunch of words, and that's not me. So, to break it down, community well-being is essentially an environment that you can flourish in. But that's with a holistic approach. Especially right now, there's a lot of talk and a lot of conversation about what's happening with us physically. That's why we're here, COVID-19. But there's also what's happening with us mentally because of the impacts of COVID-19. For instance, social distancing. We're not meant to social distance, things that are being taken away from us, this constant feeling of loss and grief. And so what we're doing as the Community Wellbeing Program is we're offering support to the community. We're reminding the community that while your physical health is important, your mental health is also important because they go hand in hand. Your mental health can actually impact your physical health. Right. And so what we're doing, some of the things that we're doing is I've connected groups with a focus on the BIPOC community. I've connected groups to mental health first aid. We have done what we call pop-ups, and those are essentially where we've offered free mental health support with BIPOC therapists even for the BIPOC community, and for a lot of people that's hard to find. And it also gives people that first-time experience if it's something that they've considered in the past. Something that we're doing, and I'll actually share a link, is we've had a couple pop-ups called Let's Talk. And, it's just providing people an open space. I believe that, negativity, pain, it thrives in silence. When we talk about these things and when we give them voice, we can not only address them ourselves, but we can also get support. And so, just creating that conversation where people can just talk, people can say things maybe they haven't said, my kid is getting on my nerves, because he doesn't want to go to school, or, my boss isn't really giving me the space that I need because I'm working from home and I'm taking care of my kid. People just giving people that space to talk and vent. And that's a lot of what we're doing.
So with what you kind of talking about with your work, we usually hear a lot about COVID-19 case trends and statistics, but your work is a little bit harder to measure. So when do you know things are improving for community well-being, or how do you measure success with what you're doing?
Well, that's a really tough question. And it's a really tough question because it's constantly moving, and it's constantly evolving. As we get deeper in this, people's needs are changing. People are actually figuring out that they have needs, when it comes to mental health. And so, part of that for us is raising awareness. Me, myself, I've gone through depression, and, sometimes it was someone else saying, hey, you're not acting the same. It took someone on the outside to point it out to me. So, raising awareness in the community, like I said, with like the mental health first aid, where people around me and people around you can recognize if something is not right with you. It's also centering communities that have been most impacted. It's no surprise to me. And so, but a lot of times that focus doesn't get to those communities. And so what we're doing is really centering that work around those communities. We have one of the big things that we've done that I definitely consider a success is we've built a coalition with partners in South King County. We've deemed it the South King Emotional Wellness League. You'll see our superhero, and it's school for short. But it's a partnership with, the NAACP, Black Nurses Rock, Federal Way Black Collective, organizations that are in South King County actually doing the work on the ground. And, the success is us actually being a part of them and not looking down as this government entity, but actually being a part of it and actually being on the ground with them.
Good, nice. So, so there's so many different resources out there and that are available to us. If you had to pick one resource, which one do you think is most important to share with everybody?
Well, I may be a little biased here, but because of the work that we've done with our own website, with our own webpage, most of the resources that you're going to be looking for are going to be on that page. And so I would direct people, and I'll also put this link in the chat as well, but it's King County /COVID/support. And you can find a lot of links there as far as different resources. You can find our email address or an email address to reach our team. You can find more information about events that we're having. And that's kind of like our hub. Where you can find all of our information. We're also, like I said, working with the South King Emotional Wellness League, and we've created a Facebook page. I'll also put you'll never remember the name, but I'll put it in the chat as well, but it's facebook.com/SKEW League. But again, I'll don't expect anyone to remember that. I will put it in the chat, as well as a couple of events that we're going to have going on this weekend and next week as well.
Great. Thank you for those resources, and we'll look for the links in the chat. And then at this time, we want to hear from the audience. So feel free to unmute yourself, press *6 to unmute if you're on the phone, or put your question in for Anthony in the chat. And please share your name if you would like to ask a question out loud. Gotta let the awkward silence roll through a little bit just to make sure we're not missing anybody.
All right, we have anything in the chat?
I'm not seeing
Nothing in the
anything. Yeah.
All right. Well, thank you. Oh,
We
is there
do
someone?
we
Oh,
do
we do have
have one more question. I think we're going to get to this a little bit later too, Andres, with our speakers from CMAR, but we can also ask Anthony about this. So can you say more on how you are dealing with the stigma of mental health, Anthony?
A lot of how we're dealing with is talking about it. Stigma is one of those things that survives in silence. I actually come from an HIV prevention background, and there's just as much, if not more, stigma in that community, in testing and outreach. And, again, having that conversation, we're not hiding it. We're not calling it something else. We're making it clear that it's emotional well-being, emotional wellness, but that doesn't mean eternal happiness. That means a balance of your emotions. And so if you're looking for eternal happiness, you're always going to be disappointed. You're always going to be let down. And so, that's what I would have to say.
Wow. Yeah. Thank you, Anthony. And then someone else in the chat, Joaquin, put, wondering about resources for immigrants who are limited English proficient.
Yes. Thank you for asking about that. Actually, this past Thursday, we held a Let's Talk COVID Trauma, Stigma, Grief, and Growth, and that was for our Spanish-speaking community. I had done the same thing in English the week before, and quickly decided that we of course needed to do one in Spanish. We are also our website. We've just updated our webpage, and we're actually going through right now. It's not okay for me to just translate the page and have resources on there that aren't relevant to who we're translating the page for. So what we've been tasked, or what we're working on right now, is going through those resources and making sure that they're either in Spanish, they have translators, or that it's a resource that is actually going to be accessible. If not, it needs to come off.
Well, looks like we have another question here. So this is from Luisa. How accessible are these resources to people living in countries?
Good question. I can say that most of the
Sorry.
resources that
I think she said counties.
Counties.
Oh, did you say county?
not
I'm
country.
sorry.
yeah.
It's okay.
I'm sorry.
No worries. Just what
Well,
it is
you
hard to
know,
see that small.
that's a little easier. In other counties, I'll be honest, our focus is on King County. But a lot of the organizations are going to have offices in other locations. Off the top of my head, I couldn't tell you which ones. I would just say check out our website, and again, I'll put that information in the chat. I'd rather you get the right information first than me try to guess something and then have to correct it. So instead of doing that, I'm going to put the link in there, and then you can check out the website on your own when you get time.
All right. Perfect. All right. Thank you for joining us today, Anthony. All this information was very helpful.
Looks like
and
there's one more question I saw down there.
Oh, is there one more question there?
So one more from, it says, what strategies are being deployed to target the most vulnerable populations?
A lot of that work is with our partnerships with South King County. A lot of times you see a lot of things happening and they're centered in Seattle. My belief is if location is your first barrier, you've messed up. And so we're actually going to where we see the numbers, which is South King County. And are we working directly with people who are 60 plus, or people with disabilities, or people with underlying conditions? Not necessarily. It's not that targeted, but as long as we're in that area, we at least have opportunity. And so again, focusing our work on the BIPOC community, on our Spanish-speaking communities, taking all things into consideration, but making sure that it's centered where people don't have to come find us.
And I think we have time for just this one last question. Anthony got popular.
Hey.
So can Anthony name important collaborations with NPOs? So I'm guessing that's nonprofit organizations or public-private institutions that have helped provide greater impact?
Oh, most definitely. As far as my work is concerned, I'm going to say yes. So with the work that we've done, I'm very proud of our partnership with our partners in South King, and I'm going to continue to highlight South King because that's where the work needs to be done. Let's just be honest. So we've partnered NAACP, Progress Pushers, Disability Rights Washington, Federal Way Black Collective, Black Nurses Rock. I know there's a lot that I'm forgetting. Black Nurses Rock. That's all I can think of off the top of my head. Still an impressive bunch, but there are more, which makes me even more happier that I can't remember all of them. If there was 5 and I could just rattle them off, it wouldn't be very impressive. But the fact that there's still some that we're working with, and we're continuing to build partnerships with our community wellbeing messengers program through marketing of our events. For me, it has to be in the community. And so anything that we do, it touches the community before it takes off, because we have to get the input there from who we're trying to serve.
All right. See, looks like we have some comments. I just want to make sure no one else is asking any more questions here.
And if you need to move on, I'll stay around and I'll kind of look at the chat, and I can chat with people that way if you need.
Perfect.
That sounds good.
We appreciate that. Yeah, that sounds great. So if you're interested in finding any of the latest COVID-19 case numbers, you can go to the COVID-19 data dashboards webpage. We'll go ahead and paste the link in the description, and we'll have it over there for you in a few seconds here. Before we talk with a few other community organizations working to support holistic health for communities, we will want to hear about the latest information on unemployment and the eviction moratorium.
Thank you, Alvin. And yes, today we are being joined by Brianna, Kiarie, and Suzi LeVine, is the Employment Security Department Commissioner. Brianna she's an Associate Director of Education and Community Services at Neighborhood House. Thank you, Brianna and Suzi, for joining us this evening. We appreciate your time and making yourself available to bring critical information to our community right now. We know that thousands of Washingtonians are hurting financially as a result of the pandemic shutting down businesses across the state. Many of the people laid off due to the pandemic are workers from the hospitality industry, like restaurants and bars.
We've heard that the unemployment benefits have run out and that the state is not approving new claims. Is this true? What is the current status of the unemployment benefits that were passed by Congress in regards to COVID-19?
So no, benefits, that is not true. The good news is benefits have not run out and benefits will not be running out. However, there's been clearly some confusion and some conflation. So let me separate things out. There's the regular state unemployment insurance, and that will persist. And then the COVID-19 passed provisions, which include the Pandemic Unemployment Assistance and Pandemic Emergency Unemployment Compensation. So PUA is that which is available for those who are independent contractors, those who are self-employed workers, those who have fewer than 680 hours or are otherwise not eligible for regular state unemployment insurance. And the expiration on that congressional legislation is December 25th. So as of December 26th, those are currently on course and speed going to be ending and expiring, which is different than running out. Running out assumes that there's not enough money, right? So it's just, it's different that way. That said, we are working on what could be a state backstop for those individuals who are on PUA and trying to figure out what the duration and the amount will be in the population will depend on Congress's action. So we are advocating heavily and have been for many months for the continuation of that program so that the nearly 100,000 people who would be impacted will not have their benefits run out. We're working hard on that to advocate, but it is Congress's action along with the administration for that to persist. And like I said, we're also working on what might be a state level backstop for that. Unemployment insurance will persist. And then also for those who are on what's called PEUC or Pandemic Emergency Unemployment Compensation, which extends benefits by 13 weeks. That will also expire. However, those who are on that would be switched over to another form of extended benefits that will not run out. So this, for those people who are on benefits, they'll be able to see that in their accounts, and we're going to be doing a lot of communications about it. But again, we're waiting to see what's happening with Congress in terms of what will persist, what may change, and it's a very fluid and dynamic situation. So may I for a second, Alvin, take a step back?
Sure.
So hi, I'm Suzi LeVine, and I'm the Commissioner for the Employment Security Department, and I wanted to thank you for inviting myself. I have two team members on the call right now, Teresa Exarn, who heads up my Equal Opportunity Office, and Steve Ruggles, who is one of our masters and subject matter experts in unemployment insurance. And we're so honored to be with you all today, and we thank you for the work that you're doing in the communities. And I didn't want to miss the opportunity. I certainly can jump into questions and do that, but I first wanted to just thank you all so much for caring for our communities during this time. We need each other so deeply, and you play such an essential role. And I appreciate what you were saying before with regards to, Anthony, what you were saying before with regards to mental health and how people are feeling right now. And I'm keenly aware of the role that economic support plays within that health as well. And my team and I are working hard day and night to do all that we can to get people the benefits that they so desperately need. So thank you for the opportunity to both clarify as well as answer questions that you all have.
Well, thank you for joining. We appreciate having you here.
Absolutely.
Osvaldo?
So, actually, Alvin, I think you're still next.
Is it still? Oh, okay.
Yeah.
So let's see. So I know the governor put the state under a new level of restrictions recently. I think it's until January 4th now, and this has caused a lot of businesses to close again for the time being. Has the governor announced any new benefits for unemployment?
So again, for those who are already on unemployment insurance, or for many people, they had been on it, and then they went back to work, and then they had to restart their claims. So we have put a lot of information on the website to instruct people on how to reopen their claims. And in fact, in just the first 2.5 weeks, we had about 62,000 people doing those reopened claims, going through that process pretty smoothly. The governor has shared that, again, we are working on what would be a backstop should those who are on pandemic unemployment assistance, should Congress not take action. So we're working on that, but we don't have anything specific to announce yet. Again, we're trying to be responsive to what Congress may or may not do. For those who are on unemployment insurance, that will persist. So that is what we are staying very ready. We're like a center fielder in baseball, where we're keeping our knees bent and trying to be able to respond to wherever the ball may go.
Gotcha.
And it's this kind of like style of waiting game and dates moving back. I guess dates are not moving back and forth, but the unknown of what will come after the December 25th or 26th is what's causing a lot of confusion and a lot of sometimes anxiety among people. And one thing I have, I recently, a few weeks ago, I saw, it's a question for you, Suzi. I saw an article in the Seattle Times that said that some people were being asked to pay back the unemployment benefits they received during the pandemic. What are the different scenarios when people are going to have to pay back the benefits they received? Is that even true?
I so appreciate you asking that. Let me separate out a couple of things. For one, I agree with you. This is terrible. Congress should have extended this months ago. This puts people in such a quandary and exacerbates anxiety so far beyond what is acceptable. I 100% agree with you that this is terrible. And we stand ready to respond as needed. However, it's Congress's action to take. We are administering the laws. And in terms of the pandemic unemployment assistance program, it is something that Congress created in March in response to COVID-19. And I don't think at that point any of us thought that this would still be going on at this point. And so when they established this CARES Act legislation, the expiration was the end of the year. But they have failed to act, and they have failed to deliver in partnership with the administration in extending those benefits. So unfortunately, we remain in a state of limbo in knowing, will they persist beyond that point in time? And this Governor Inslee spoke about this in his press conference on Monday, and I've sent letters that were co-signed by both the leadership and ranking members of committees in the state legislature to our delegation. Our federal delegation has advocated for the extension of these benefits. So you're right. We should not be in a place where we have questions on this. So going back to your point with regards to overpayment, pre-COVID-19, in a typical world, overpayments happen when somebody receives benefits and it's determined that they're not eligible, and then they have to pay back the benefits for which they were not actually eligible. It doesn't happen that often. It happens sometimes. And we work with people to develop whatever payment plan works with them, and we are very generous with those terms. Somebody could pay us back $1 a month, $5 a month, whatever. But it's generally something that happens, and it happens all across the United States, and it's a standard part of unemployment insurance, that sometimes it's determined that somebody's not eligible. With the introduction of these new programs for the very first time, what's great is that more people can access benefits who have never been eligible before, but it has introduced a level of complexity and a level of confusion that has been very, very hard. And it's been difficult to implement it. You can imagine there's times when people switch between one benefit and the other. And we've developed our systems and been iterating on our systems to do that more smoothly over time. But we needed to get that benefit out as quickly as we could. And we got it out within 3 weeks of the legislation passing because we knew the desperation out there, but it has been very difficult. There are still those scenarios where somebody will have received the benefit because we got the money out, and then it was determined that they were ineligible. An employer replied and said, actually, they were fired for cause. And we then need to basically rescind that eligibility and ask for the overpayment. But the article in the Seattle Times was a different situation. And that was a situation where, because we can only pay people pandemic unemployment assistance when they are deemed ineligible for regular unemployment insurance, so we constantly have to assess that eligibility. So let's say you hadn't been eligible because you hadn't worked the requisite number of hours in the prior 12 months, but then you went back to work and you did. And so all of a sudden your eligibility changed. So what we did was we sent out notifications to those whose hours we had received from employers to ask them to file a new claim. And we sent out about 26,000 of these notices. Half of the people responded, filed a new claim, and there was no issue. But unfortunately, half did not respond. And they didn't respond. Some of them had gone back to work. They didn't think they had to answer something from ESD, or some of them weren't able to go through and complete the process. What we've asked everybody to do who has received one of these overpayment notices for these points is file an appeal. Filing that appeal suspends the overpayment notice, and they go into the appeal process. We, in the meantime, are looking at reaching back out to those individuals to try to remedy it in a different way. But in the meantime, it suspends that overpayment notice. And I know that this is confusing, and I know that it is that the confusion compounds people's anxiety. And I am so sorry that there is not more that I can do more quickly to update our systems. We are working as hard and as fast as we can. And please know that in the past 10 months, we have done more technologically and customer service-wise than any agency has ever done in that time span. It is just a lot, and it is it is complex, and it is hard.
Yeah, Suzi, and I think that's you provide thank you for that clarification, because it's important to know when different things are being triggered and what's, and also a reminder that each individual scenario is going to be different, and it's going to vary literally from one employee to another. And that is a perfect segue to a question I have for Brianna, who is also on the call. And as earlier mentioned, Brianna is the Associate Director at Neighborhood House. Brianna, now that we've heard this more technical clarifications from Suzi, I'm wondering if you can tell us, our last question before we move on to our community questions, if you can tell us about the different community organizations and resources available to community members so that they can navigate this complicated world, right? Like Suzi said, it creates anxiety, creates confusion. What are some of those resources available in community?
Thank you so much, and good to be here with you all. I'm with Neighborhood House, and we have been a partner in trying to help community members navigate the different community resources, but including unemployment benefits. We, of course, are not Employment Security Department, and so, and as you've just mentioned, every case is different. And so the work that we are able to do is just help people connect, like we'll make phone calls with folks in different languages, help them navigate some of the changing phone systems that ESD has, and knowing which buttons to push and how to get into which queues that you need to get into. And they've updated to have more language options for that. And staying on top of the website and helping people figure out how to, start an account and kind of guide through the process or point them to resources. We did also create a number of little videos about what the expanded benefits were at the beginning in springtime. And I think we did 11 different languages along with community partners, it basically was the information on the ESD website, but just to say, this is what's available. So we're trying to just bridge that gap of understanding. But because, of course, it's so complicated and dependent per person, we're not able to say what's exactly what, but help people connect with who they need to connect with, and with a number of partners. And we also, as a partner in the WorkSource system, I just want to say too that there are some more resources for people who are designated as what's called dislocated workers, which are people who have been laid off and maybe aren't reentering their jobs, but are interested in looking at other types of training opportunities and some supportive services around that as they kind of reimagine what their next kind of career move might be. A lot of it's such a weird time to do that, but for some folks, it might be the right moment to kind of take pause. And so there are some more resources in our region around that, and we're helping people kind of navigate and working with that support along with other partners in the WorkSource system. Happy to
Brianna,
connect directly, and I can put a chat into communications.
Right. I was gonna lead to for Suzi and for you, Brianna. If you we wrap up this segment and move on to a community question, that will unfortunately have time for one. Is if you can please put on the side, Suzi, for ESD, the information for who do they contact? I'm not sure if you're providing your contact information, and Brianna, also for you, what is the information that the folks can reach out to, and also keeping in mind folks that are non-English speakers, immigrant and refugees, so that can also seek those services that are applicable in multiple languages too. Again, sorry that Suzi and Brianna, we felt a little bit rushed, but unfortunately we are running a little bit of time. We're running out of time, but I do want to say thank you for being on the call, and please put the information aside. I appreciate you, Suzi, clarifying some of those questions, some of those confusions and myths, and I'm sure we can spend hours clarifying what are the rumors going around the mill. But I'll pass it over to Alvin so you can take us into a community question.
All righty.
Oh, Alvin, do you mind if I actually just finish off with one comment, though? I'm so sorry to interrupt.
Yes, let's.
Well, it's basically just to share with you all that if you know people should be encouraged to take a look at their accounts, their e-services accounts, because a lot of messages are sent that way. Please don't ignore the messages. Even if you've gone back to work, again, there's complexities, and we do need people to tune into that. And if you do have questions, Osvaldo, would you mind if people share those questions with you? We would love to debunk the rumors and or answer the questions and help have this as a conversation. I really appreciate opening the door to that. Thank you.
Perfect. Yeah,
Absolutely.
one of the things we encourage folks is to send questions in to us, and then we can follow up with you. Yeah. Alvin, thank you, Suzi.
Yes,
Have a good evening. Thank you.
You too. All right. So we are going to open up with some of the community comments here and questions. So let's see here. We have, I think the first one here is from Bell P. What about individuals who have lost businesses and have never received unemployment compensations during COVID? Is there a strategy to assist them?
Well, this is Steve. It looks like Suzi's dropped off to her other engagement. So to address that, as far as unemployment insurance is concerned, as Suzi mentioned, the pandemic unemployment assistance program was available to those folks and still is available for those folks. So, unfortunately, if they've lost their business, then, at this point, they could open that PUA claim, identify the date that they no longer were self-employed, and then file the pandemic unemployment assistance claim. And whether it goes beyond December 26th or not, that's yet to be determined based upon the congressional action that they take. But we do encourage them to. It's not going to probably be the same as their self-employment amount, but it will be a safety net that might help them tend the bad times that they're going through.
All right. Thank you very much, Steve. And if you have any other questions, please feel free to put them in the chat, and we can get these questions over to Steve and Suzi to answer these. Right now, we're going to go ahead and transition on to our next segment here. So with all the pandemic impacts on employment and health, King County has stated that our region faces a looming eviction crisis of unprecedented scale. Here to talk more with us about the latest on the eviction moratorium and rent assistance are Sokha, Dulcie, Audrey, and Stephanie with Office of Housing. Welcome and thanks for joining us.
So one question on everyone's mind is, will the eviction moratorium be extended? And I think Dulcie might have some more information on this. So have you heard any talks about this at the city, county, or state level? And if it's not extended, what are some resources for folks who are relying on the moratorium to stay in their current housing?
So the latest intelligence tells us that it's likely the moratorium, which currently expires on December 31st, that's the state and the city of Seattle moratorium, will be extended through March. So that's the current intelligence that we've heard of. I would think it would be, impossible for them not to extend it. And so we don't know, will there won't be any changes to the Seattle moratorium, which has some differences to the state moratorium. Don't know if there will be some changes to the state moratorium. There have been some changes at each extension point, some very minor. The main difference between the two moratoria is that the state does provide exemptions to the moratorium if the property owner wants to sell or occupy the property. The Seattle moratorium does not allow for that. It only allows for evictions where the tenant is presenting a clear and present hazard to health and safety. So the other thing that I should mention is that Seattle City Council quite a while ago passed a recovery bill that will go into place as soon as the moratorium is over. And that provides a 6-month sort of cushion after the civil emergency is over, whereby not being able to pay rent because of COVID is actually a defense to eviction. So that will be for 6 months after the moratorium ends, that somebody can present that as a defense. They'll have to certify that the inability to pay rent was connected with COVID. And then also during that recovery period, there are mandatory payment plans as well that the city council passed. So there is some cushion there that's going to apply in the city of Seattle once the civil emergency ends. And again, we believe that the current December 31st expiration date will be extended through March.
That's great. That's great. So I have a question here. So I was talking to someone recently in the community, and they heard that there are some apartment buildings that are not currently renting to folks, and they kind of just preferred to keep the apartment vacant for fear that the tenants can't pay the rent, and then there's like no recourse for the lost money. Is there anything that can be done to like combat this, or is this even legal for landlords to do?
Well, I haven't heard anything like that. In fact, the numbers show that 87% of people are paying their rent. So relatively speaking, that's not a huge number considering the impact that COVID has had. I haven't heard about what you're describing. What I have heard, though, are people who are in units already, and units that are vacant are being discounted deeply because they're trying to fill them up. And then the tenants who already are paying above that rate are looking for the rate to be lowered to the rate that they're trying to market new tenants to. So I have heard that going on, but not so much about keeping units vacant. And I don't know that makes any financial sense. Also, if they market empty units, they have to offer the unit to the first qualified applicant. So, I mean, I don't know, are you hearing that they're just not advertising or marketing vacant units because it costs them less to keep them vacant? I don't know, but I haven't heard anything like that.
Okay.
Okay. So, are there any additional resources for rent assistance in Seattle and King County? And where can people find the latest updates on those resources?
Yeah, thanks, Laura. This is Stephanie Velasco from the Office of Housing. And between myself, Sokha, and Audrey, I think we can tell you about there are three different rental assistance programs, and I will probably focus just on two, just for time. But the first one is a rental assistance program that actually just recently closed. It was a King County or United Way of King County had rental assistance funds through the city of Seattle that were being dispersed through the end of this year. So that process just closed, but I'm going to share a link in the chat here. There is rental assistance that will be become available again starting in January. And so if there are folks who do need rent assistance, we're encouraging them all to go to that link that I just put in the chat and put their information in so that they will be made aware when those new rental assistance funds are become available. So that's just to throw out some numbers here. That's $8 million specifically that the city of Seattle set aside from the city's reserves to go towards rental assistance and eviction prevention in 2021. And I really appreciate all of the questions you all have been throwing out here to the speakers, specifically about language access and equitable outcomes. And so I'm going to pass it to Sokha, I think, to talk a little bit more about how we've been doing that. And then Audrey also has another rental assistance program that she can tell you about.
Thank you, Stephanie. My name is Sokha Don. I'm with the Office of Housing, the Community Engagement Specialist. Just to piggyback on Stephanie, she talked about the United Way King County program, which the City of Seattle partnered with. That program just ended. And then this additional $8 million will be available through a City of Seattle program, which has yet to be, I think, developed further. But the intention of this program is to not make it a lottery in 2021, is to work with community-based organizations. So we really reach the most vulnerable community members with this process. One of the things Stephanie and I are working on right now is actually a survey to get feedback to ensure that we get input from community members, and also that we reach community members as wide as possible, especially those vulnerable, with outreach. I think secondly, want to talk about our strategies in order to reach communities of color. We've been working very diligently with ethnic-based publications and also publications that have high readership of communities of color. I think notably we've been working with South Seattle Emerald. So if you're a subscriber to South Seattle Emerald, you'll notice that in their weekly inbox, we are advertising with them, and they have a far and wide reach. We recently just advertised with Dias, and also the International Examiner, just to make sure there's awareness about these rental assistance programs. And that's something strategically the Office of Housing is hoping to do, obviously, post-COVID and in perpetuity. I think that's it on my end for now. I think lastly, if we have time to talk, maybe later on or not, Stephanie and I can put our contact information, but there are homeownership resources that the Office of Housing has specifically for homeowners, including our home repair program. It's a 0% interest loan to do critical home repairs, and a program called the weatherization program, which is open to homeowners and also renters. It's about keeping your home comfortable. These are really our direct action displacement strategies from the Office of Housing. I think next, Audrey, if you don't mind talking about the eviction and the rental assistance program too as well.
Perfect. Thank you so much. So I'm Audrey Triantafillidis with the Homelessness Investments Division with the City of Seattle's Human Services Department. And so there are there's two primary homelessness prevention programs that I help manage. And we have base contracts that are typically targeted for the most vulnerable populations. And that is an annual investment of around 2.2 million. So our providers, we work with 12 community-based organizations with target populations that are directed to Black, Indigenous, and people of color communities. And so we are able to kind of leverage support for the most vulnerable communities. The program eligibility, for instance, there's a vulnerability assessment that's linked to it. And some of the criteria within that would be assessing housing status, household income, vulnerability, and housing barriers. And so this is a base contract that will be renewed at the beginning of 2021. Additionally, in terms of federal funds that's coming to us through CARES Act dollars, there's 2.8 million that we term as emergency rental assistance, and it's the CDBG emergency rental assistance. And so we partner with 8 of the 12 homelessness prevention providers to help deploy these dollars. And what's different about this program is that there's no case management involved. It's a one-time assistance, and the primary program criteria would be COVID impact. So there needs to be some kind of verifiable impact to a household's income to be eligible for the program. In addition, they would need to be a City of Seattle resident. The applicant applying must be named on the lease, and the household income needs to be 50% or below AMI with documentation within the last 30 days. So those are sort of like the 4 key criteria for program enrollment into the CDBG Emergency Rental Assistance Program. And the way we help target the vulnerable populations, again, is working with community-based organizations, right? And so at the beginning of the pandemic, the information that we were receiving, interacting with our agencies, helping them get ramped up with the new program implementation, is that they were receiving a huge amount of influx, many calls, the demand was high. And so at that point in time, we didn't really do any public outreach. We just allowed them to filter through their queue of inquiries that were coming in from their local communities. In 2021, however, there will be 1.4 million with anything that's not spent down from the funds that we contracted this year. We will be doing a little bit more outreach in terms of with the language materials, helping to deploy and reach perhaps different demographics that we weren't able to this first round. So I feel like those are the 2 primary programs that I want to talk about, and then I can answer questions.
Thank you so much. Yeah, it looks like we do have a few questions in the chat, and I think the ones that are in the chat are the ones that we'll be able to get to. I did just want to read aloud that we got one that said, what is AMI? And Stephanie and Dulcie both answered in the chat, and AMI equals area media income. It's a common way that these types of programs use to determine eligibility.
Correct.
I just wanted to butt in real quick, because I forgot to mention, and this is not direct services. This is not something that people can access. This is, we are managing 1.7 million in grant assistance to community organizations with a heavy emphasis on eviction defense, because we are anticipating that the COVID recovery and the end of the moratorium will see getting evicted. And so I just wanted to mention that solid ground you received funding assistance. So I'm sorry, I just wanted to say that because I forgot. Thanks.
Thank you. So we have a few questions in the chat. Let's start with, I think, so someone asked, can we get a link to the rental assistance programs? Is that the United Way King County link that you put in, Stephanie, or is there another link?
Yes, I provided the United Way King County link, and I think if there are other links for the programs that Audrey mentioned, maybe she can share those out.
I do not have a link, but I will list my email. And is there an option to add a PDF to the chat box? No?
I'm not sure with
Okay.
WebEx
Okay.
if that's a possibility.
Thank you. I'll put a link in there.
Okay. And then we'll go to one more question in the chat, and then we'll need to move on to the next section. Alvin, do you want to read the one from Luisa?
Yes. Let's see here.
And it looks like Stephanie put an answer in there.
Let's see. So Luisa Chin, she said, would lower income individuals qualify for these rental housing programs? And then the response is yes. The program, United Way Rental Assistance Program, is specifically targeted to assist individuals and households earning lower incomes. Same for the programs Audrey mentioned. And then someone else asked the question, I'm hearing there's a barrier to qualify for the programs for unhoused persons who don't have a rental history. Is this true?
Well, the first thing that I unhoused, meaning they are doubled up or couch surfing, that might be the question. Because the rental assist, my programs are helping people who are already housed, right, at risk of eviction.
The answer to Audrey, this is Idris Beauregard. I'm a director here at the Seattle Public Utilities. Thank you for sharing. And the answer is yeah, these are persons who don't currently have housing, and they were trying to find some type of housing, and they keep running into challenges with not having extensive rental history.
So what I'm thinking is, and Brianna can speak on this part too, because she's at the agency level, I'm thinking this would be more of, this wouldn't necessarily be a homelessness prevention issue in terms of programmatic, but it sounds like they would need to be linked up with a community partner who could help them walk through that process of like eliminating their arrears and application process for homes. The housing, the community partners will also have resources in terms of the housing locator program, and I'll let Brianna speak on that. She can chime
Sure.
in.
Yeah, I'll jump in on this one too. I'm Brianna from Neighborhood House. We also have some housing stability programs, including we're one of the partners that Audrey mentioned in the rental assistance program. And happy to, I'll put my email in the chat as well. So if you have questions or want to link to one of those, happy to connect. But additionally, thanks for the question around folks who are unhoused. So there are a number of programs that can help with that. And we are a partner in working with some of the rapid rehousing programs that help folks who are unhoused find secure, safe housing and help provide some rent assistance for some period of time. We are finding at the moment that we actually are at full capacity there, and I'm imagining that might be something that is experiencing, the other partners are experiencing. However, we can certainly help people navigate to do the the process with coordinated entry to connect and hopefully connect with a partner on that. So I'll leave my email in the chat for that as well, and to just connect on that. But folks can also connect through 211 or the regional access points as well. But there are a number of programs there. I just don't know all of the capacities for the different partners at this point.
Great. Thank you so much, Brianna. And then also Sokha, Stephanie, Audrey, and Dulcie. Wanted to make sure I got everybody's names for that helpful information. So yeah, I think as we're moving into a lot of unknowns, it's nice to hear from Dulcie that there have been talks of an extension of the moratorium. So now we're going to have a chance to chat with a few folks from CMR Community Health Clinics about what they're doing to support community health during this time of uncertainty. Osvaldo?
Yeah, thank you, Laura. And I've seen other questions on the chat bar. We'll make a note of them too. So if they were not answered and you have a question, please write your contact info so we can follow up with you as well. Welcome, Luisa. Welcome, Hannah. Luisa Chin is a mental health therapist with CMAR, and Hannah Hamilton is a director for CMAR Health Clinics as well. Thank you for being here this evening. We appreciate your time and contributions to the program. As you've heard from our opening segment, our focus this evening is on the various ways the pandemic has and continues to affect people. We know millions of people have lost their jobs. We also know that close to 300,000 Americans have died due to COVID. 2020 has been a very difficult year for many of us, to the point that, in fact, recent research studies have shown that people's mental health has taken a toll due to the pandemic. Mental health is one of the most important aspects of our holistic health, and I'm so glad that you're here to talk a little more about that. First, I know CMAR is open to supporting everyone in the community, regardless of income or immigration status. Tell us how someone who doesn't have insurance, or maybe who's not a legal resident or a U.S. citizen, how can they access services to CMAR, especially mental health services?
Well, thank you, Osvaldo, for having me and Hannah here today. In terms of like immigrants or other individuals who has a different status, right? So how CMAR have we been supporting individuals with a different status is that we provide sliding fee scale, and depending on their income or their salary, the sliding fee scale has been very helpful for a lot of people who are seeking mental health. And along with that, there are some grants that goes here and there, and then we try to be on top of those grants in order to to introduce those grants to clients who have no insurance for whatever reason. And in order to have access to those grants and sliding fee scales, immigration status don't matter, and it's not a question that we ask about what kind of like status they are in. It's not a question that we ask for them in order to have access to that. And if anyone have questions, we always can connect them to our financial specialist who will be able to fill in more about their questions and understanding about their being able to assist them in their depending on their financial struggles.
Where I have a follow-up question with that, Luisa. Where are generally your clinics located? And kind of thinking about Seattle being our focus for the evening, where does CMAR kind of has some of their clinics?
So CMAR is kind of all over Washington, and so I could send a link with our different locations in different counties, and then we also have dental, we have medical, preventative care, and other also like pharmacy and other medical, other assistance too. Can't find my word. I'll send a link, and let's say if you are in King County, just click on King County, and then we'll pull up a list of where are the different medical clinics. There are several medical clinics in King County, where the behavioral health clinics and dental and other services in that county as well.
And I know from personal experience, the language access is also language barriers, something that you always keep in mind as you're providing those services, right? Yeah. So also from my personal experience, my Mexican parents would never consider seeking mental health services because they think that seeing a therapist means that something's wrong with your head. While I'm working to change their minds on the importance of mental health, how does CMAR support individuals who have stigma against mental health? And maybe how would you recommend someone approach a loved one about seeking mental health services?
Well, first, thank you for doing that important work, right? Because seeking mental health, there's a lot of cultural stigma or social stigma that brings a lot of different perspective from our culture, and also shame in general, or other responsibility from whatever experience you're going through. So we have our doors open to whoever, anybody who speaks different languages, right? And we have, depending on the clinic, of course, we have therapists that, besides offering services and therapy services in English, we also have services in Spanish, services in Chinese Mandarin, also in Farsi as well. And if we don't have that language service, therapist speaking a certain language, we offer interpreting services, and we try to accommodate our clients to open our doors so they could receive the mental health care that they are trying to for the first time, and then we try to accommodate that.
That's great. That's awesome.
In trying to like when we're at home and we're feeling like stressed or anxious, is there a simple mindfulness exercise that you can share with us to help people when they're feeling that way?
Yeah, I really like this mindfulness exercise, and we're just going to take a couple of minutes and practice it just to help you guys really soak it in and feel it. And so what I want you to do is just notice being in your chair and be comfortable, noticing your bottom in the seat and your feet on the ground. And you're just going to scan your body from head to toe, just noticing any distress or unusual sensations. And as you do so, notice what shape those sensations have. And maybe if they have a color or a temperature, a texture. And then I want you to pick a color that for you is healing. And I just want you to notice that healing color coming from the cosmos, from the universe. There's never ending amount of that healing light. And as it comes from the universe and gently, softly enters your head, just notice it going to those body sensations. Notice it vibrate and permeate, filling all of that space with the healing light. Noticing it move in and around those sensations. And as more and more of the healing light enters, just notice it gently, softly filling your head. So much light it moves down through your neck and your shoulders, down through your arms, out your hands and fingers. And just notice more and more healing light move through your chest, gently down through your abdomen, through your pelvic area. Feel it moving through your upper legs, your lower legs, and down and out your feet. Noticing more and more healing light entering and filling every part of your body, vibrating and moving through every cell. And anytime you need to, this healing light is there for you in the universe. And you can take a minute and let it gently flow through you, moving through all sensations and all body parts and filling you so much that it comes out your fingers and feet. And you have this resource anytime you need it. And when you're ready, you can open your eyes and take a breath. And thank you.
Wow. Thank you so much for that, Hannah.
That's very helpful.
I'm feeling more relaxed right now for sure. And now we can open it up. That was awesome, says Lori.
I know people are very glad. I think it's so, Laura. I know it's so important. Like we forget to take the little 2-minute break during the day, right? Like,
yeah,
and that's so important. I mean, a little good reminder for all of us.
And so now that we're feeling more relaxed, we have time for a couple community questions. If anyone has any questions, feel free to add them into the chat for Hannah and Luisa, or feel free to unmute yourself.
And while we're waiting for chats, I just do want to reinforce that people can come to services with us no matter their ability to pay, and that we are also serving people phone, video, and limited in person. So we are here.
Thank you, Hannah. We might hear someone typing a question, but we'll give it another 10 seconds. And thank you, Luisa, while we wait for typing that link there. Thank you for the contact information. And then, yeah, I don't think there'll be questions for this. So thank you again for your time. Thank you for that mindfulness exercise. And we encourage folks to visit that link and to reach out and to never, put mental health in the back burner, because it should be at the forefront as we are dealing with so many stresses and anxieties that are kind of still lingering around from this year. Thank you so much, Hannah and Luisa, and good to see you.
Thank
We'll
you.
go on to the next segment. Our next segment is seniors in isolation with COVID-19 infections spiking back up again. And this is our last segment. And sorry, for transparency, we are running about 10 minutes late. So we do apologize for that, but we encourage you to stay with us through the end. Again, with infections spiking back up again all over, many of us are forced to revert back to staying indoors and avoiding large crowds. This is especially important for seniors and older adults who may have underlying illnesses. But how is this affecting them mentally and physically? Join us to talk about how COVID-19 is affecting seniors in isolation is Dian Ferguson. She's the executive director in the Central Area Senior Center, and Mitch Hunter, training coordinator of GenPRIDE. Dian and Mitch, welcome to the show.
Thank you.
All righty. So, I'll actually ask this question to Dian first, and then Mitch, feel free to chime in afterwards. From your point of view, how is COVID-19 impacting seniors in Seattle?
I think for the most part that seniors realize that they're in jeopardy and in danger of losing their lives. So that's a reality for them. And so many of them don't want to come out of the house at all. And so we have had to adapt our programs and our activities where we are doing more in terms of delivering programs to them on site, like food and groceries and prescription drugs, something that we really had not done before. We never delivered meals or groceries. And so I think they're just very cautious, especially the ones that were part of the Depression generation. They're very concerned about their overall health.
I wouldn't be. I'm not surprised. Everyone's concerned about their health. So, what are some of the challenges the seniors face? I guess what are some of the challenges that they've kind of come up because of COVID?
Well,
did you want to catch that, Dian, or?
Yeah, either one of us. I was just going to say probably the thing about COVID, I think that's everybody's reality, is that they had to change what they were doing. One of the things is seniors are very independent, and so want to be reliant on anybody. And so one of the things I always say that I learned in life is that you ask for help when you need it. And so discovering is that people are asking us for help. And that's why after we've surveyed them and talked to them and check in on them, we try to provide the assistance that they need, which is how can I still live my life, stay home, and not feel so isolated. So, we're doing everything we can to try to connect them through phone calls, through Zoom activities on tablets, through delivering meals to them, and just partnering them up with other seniors, almost like pen pals.
That's really pretty much in line with what we're up to as well. I know that we share the fact that we're part of the hub system. So we're all doing kind of the same things for veterans and seniors. And I think all of us in the nonprofit organizations have learned very quickly that we had to pivot. So very few of us had services that were, completely online. And for those of us in the, that handle and work with seniors all the time, there weren't that many people who are totally technically comfortable. But I will say that here in Seattle, we have a lot of folks who are good with technical and with technology. And, we sometimes think, before we hit those ages of 60 and 65 and older, we think, oh, nobody's going to be able to really handle that. Well, let me tell you, our seniors have come out, in droves to be able to do that. And senior services in general throughout the city and county are scrambling to make sure that folks do have access to some sort of technology so that they can get access to the programs that are happening in these senior centers. Everybody's stepping up, and so GenPRIDE Seattle, one of the things that we did is we had to pivot. We pivoted all of our programs to be online programs, and we have just had some great success with health and wellness kinds of programmings. We had a healthy cooking class that worked where we delivered groceries to folks the day before or the day of, and then they worked with someone at Lifelong that we had a connection with at Lifelong, who actually ran the cooking class. And so they got their groceries delivered and they got their things out and actually did the cooking while everybody was in the same room, so to speak, same box, I should say. We've seen a resiliency, I have to say, among our seniors because there is a statistic that about within King County, these numbers are about 3 to 5 years old out of a survey, but 52% of older LGBTQ adults feel that they lack companionship. And 54% of older adults feel isolated from others. So sometimes within our cultural differences, let me say, and ours, I would put our culture at the people of the rainbow, kind of level with all the alphabet soup, but that many of us don't know how to kind of navigate and have specific cultural differences that make it difficult to reach out. And some of our folks, like Diane, you mentioned, have come from a really long period of time, a long time ago, where 83% of them are less likely to come out to come out as gay or lesbian or trans, even than people under 30. So it's like people have had to step up and become resilient and learn how to ask, just like you said, for help. And I'm just pleased that for the most part, I think the senior services are working really hard to get people on board.
I think that's particularly true. One of the things that COVID-19 has taught me is how we can partner with people we might not have thought of partnering with before. I'm amazed at how many other agencies have either found us or we found them. We are delivering probably almost 200 grocery totes to seniors, not only from the central district. We go as far south as Renton. We have a partnership through our hub with the Des Moines Normandy Park Senior Center. And so we just had a COVID-19 Thanksgiving turkey giveaway with groceries where we served 490 people. But that would have been possible, and we did it at 3 sites because we have found lots of new partners. The Federal Way Black Collective that you talked about, the Phenomenal. These are all groups that are South King County based that we partner with to do a drive-through grocery delivery. We did it with the First African Methodist Episcopal Church. We've discovered some restaurants in our neighborhood that were willing to help cook meals. We discovered a wonderful agency in Renton that have volunteer drivers that help us deliver our groceries. And so one of the things that's just been real amazing is how people find each other and they be creative. This Saturday, we are actually having a holiday feast and we are delivering with the help of volunteers. So far, been 60 people that have signed up to have a holiday feast. And this evening, we've had all kinds of people bring us gifts and presents. So we'll deliver a holiday feast with gift cards and presents to our seniors. And all of these are new partnerships that did not exist before. One of the things that we had to do was upgrade our technology. We're doing things that we never did before, create a YouTube channel, Facebook Live, Zooming, tablets, one-on-one instructions for some seniors on how to use them. And the other thing that's really interesting is I tell people that many of our seniors didn't even own televisions. And so that's why tablets, different other means are important because they're readers. I knew before COVID-19 how many readers we had and how many seniors actually didn't have TVs, didn't do social media. And I'd say in the African American community, one of the stable things for their mental health has been their the faith community, and that the thing they miss the most, especially among many of the women, is going to church. And so they learned how to do Facebook Live. And as a result of, because many of the churches and congregations went online for church services. And so we've been able to utilize that to get them to do some Zoom programming and to be a little more interactive and utilize social media more.
Yeah, I wanted to say that we've got a survey on our site and I will put the links to that. That was a kind of a COVID survey to see how you are, what do you need, how's everybody doing? And as a result of that, we ended up hiring a part-time social work kind of folk who put together, and we've put together a chat buddy program. I think you kind of talked a little bit about that, the pen pal kind of thing, but we have a chat buddy program. We've served a little over 200 people with consistent conversations, matched them with folks from our community. That's been ongoing.
That's awesome.
And it's just amazing that Diana, like you said, we found ways to kind of come together and to use the services that we do have and share. And, what are you doing? And we've been able to find folks at the city of Seattle. We're continuing to look for technology that we can, hand out to folks and make sure that we've got the accessibility part that we're doing. And through the Hubs program from the city and the county, we've been able to kind of reach out to rural areas that we may not have had any kind of connects with them.
And I would just like to say one plug, because one of the that has helped us all is the flexibility that the county and the city has given us in terms of our contracts and our dollars to readjust what we're going to, be facility-based programs into these new programs that will allow us to continue to serve seniors and to address isolation and health issues and different things. Because if that flexibility wasn't there, it wouldn't be possible for us to maintain our staffs to do this kind of work.
Thank you, Diane. And this question is just kind of for anyone who can answer. How can community support GenPRIDE and Seattle, the Central Area Senior Center? How can community get involved?
So I could say that we have actually been open the entire time, and we're practicing social distancing. We're fortunate that we have a 12,000 foot square facility that will be transferred to us on Tuesday, December 15th from the city of Seattle, which we're very excited about since we've been here for the last 50 years. But one of the things is, if you come, you would think we were the grocery store, because we have 2 freezers. We have a whole room which is just stockpiled with food. And so we have a need for volunteers. really help us put together the grocery totes and help drive for us.
Mm.
An ongoing need that we have.
And I would say the same. Most of us that are in these services can use volunteers. We've got a great volunteer thing. I can chase it down on the site, but you can find it pretty easily if you go to the main site, the GenPRIDE Seattle site. One of the things that volunteers have been doing was we worked with a community members from a group called Cheer, who were our drivers for for a lot of the grocery runs, and then we staff. I got to fill in as a driver. I wore my driver's cap and everything, so that was really fun. But those kinds of things are always going to be helpful. And then also connecting us with those that are either younger and or connected with resources, just like we talked about technology, and maybe even the chance to consult with some of these folks for some of our technical services that we're having to step up. So that would be that would be helpful, because every now and then, as we're trying to upgrade our technology and making sure that we're doing some things, I know too, as Diane, I know you are, and we are moving ahead to do our next contracted goals for this next couple of years. That one of the things is looking at how we can better serve people that doesn't necessarily require Wi-Fi. So how is it that we can use some other services, somewhat like closed circuit broadcasting or broadcasting, and partner with people at the city? I know there's a senior channel, but partnering with some of these other folks to do that. So if you're working with companies where you have that kind of expertise, those are valuable kinds of volunteer things that we could all use, I think.
And for us, we are fortunate that we're close to Garfield High School and Seattle Academy and a couple of other schools. And one of the things that our seniors are really wanting to know how to do is how to use their phones. Today, one of the number one questions when a senior calls me up is, how can I talk to my kid, my grandchildren, or my children, or else? How do you go on the internet? Can you do that on your phone? Different kinds. So to some limited degree, we're fortunate to have some students that help our seniors vis-a-vis calls and teaching them social media. Today, one of our seniors didn't know what the telephone number was for their phone. And so one of the students helped them understand how they can find their telephone numbers to their phone. So, seniors know they have to be adapted.
Yeah. It's so true. My grandma literally went from not having a phone to now calling me on FaceTime on a regular basis. They are adapting, and they're very, very, very independent. I have a question for you all from the community here. It says, how do you support seniors for homeless, I guess seniors who are homeless, I moved away, who can't necessarily or don't want to go to a shelter because they feel it's unsafe, and they can actually end up getting more sick, but do not make enough income to have rapid rehousing?
So I can tell you about what we do here, and sometimes I kind of keep it confidential, but we actually have a number of homeless seniors that we actually allow into our facility to use the computer to check their emails and different things. We also have a small emergency fund that for the weekend of Thanksgiving, we actually bought hotel stays for 7 days for a number of our homeless seniors. The other thing that we've been able to do is to allow them to use our address as a site that they can have their fresh bucks and their vouchers come to through the Safeway voucher program and different things like that. So those are some of the things that we're doing. We allow them to use our address. We have some donors, a variety of donors who will do hotel stays for them, utilize our address, give them some respite here, practicing all the things that we do. We do the temperatures and all of that. But we also understand that seniors, really sad, and to the extent that we can, we try to partner them with some of our seniors that do have housing, that are willing to allow them to take them in. And these are seniors who might be off the grid in terms of they never would go to shelter. And this is particularly true with our veteran men, our veteran seniors, and some of the women that are much older that have lost their housing because they were evicted, unfortunately, for creation of new apartment buildings that only serve higher income people.
Unfortunately, I don't even know anything as specific as that. What I can say is that we do have some services that we partner with DSHS and actually allow people to sign up for healthcare, to sign up for, and I'm taking notes tonight. Let me tell you, right and left from all the help that we've talked about tonight. And so the rehousing and services, a lot of these programs are new to me, but I am also not the person who handles that at GenPRIDE. So we do take in certainly questions about that. And we do have a number of grocery cards that we work with people on and are trying to, as best we can, provide for the questions that do come up with folks. And we have there is a particular number of seniors here in Seattle, I will say, that are transgender, non-binary, or gender diverse, who are not welcome at the shelters, despite the fact that it is illegal to discriminate here in Seattle. But we still find that happen quite a bit. So we're pretty on it with other groups, looking to partner with other groups in how we can take care of our folks. Because really, when it comes down to it, we're all the same, right?
That makes my heart warm. Thank you for sharing that, Mitch. Alvin?
Yes, I wanted to check really quick to see if Ruby Holland was on the line here. Is Ruby Holland on the line?
Ruby, if you are, you might have to press *6 to unmute if you're on the phone.
Can you hear me?
Yes. Hi, Ruby.
Hi, how you doing?
Good. How are you?
I'm good. I couldn't get that syntax to come on my computer, so I'm sorry, but I decided to call in. I'm one of those seniors that are technically challenged, if you may. My name is Ruby Holland, and since 2016, I've had a group of senior homeowners in the CD, basically an online support group for those. I've been self-quarantined since March of this year, when Governor Inslee a couple of weeks ago said that he was going to extend the shutdown. I, immediately thought about us seniors, that have been self-quarantined. We need to do something to help ourselves with social isolation. So I thought that a Zoom check-in would be a good thing to do. Basically, small groups, about 8 or less, that would meet either once a week or twice a week to, once a month or twice a month, to basically check in on each other, to make sure we're all safe. We start each meeting, of course, going over the AARP guidelines for internet safety. I think that's really important. That's something that we should keep on our radar at all times. Pretty much the goal is to have these groups throughout the city of Seattle, so that nobody will be isolated. Even after COVID, when everybody else is back working, we still would like to have somebody check in on us, if possible. So, you can start your own group. You could attend my group to get started, or you can start your own group. If you'd like, I can send you a flyer to share with your adult children, or your caregiver, or your other trusted person that would tell about the service, tell about the Zoom check-ins, and, you guys could discuss if that would be something that would work for you. I could also send you a link to the ARP guidelines for internet safety, which is something that everybody needs as seniors. And I also have directions on how to get on Zoom and how to use Zoom. So if anybody would like that,
My email address is keepyourhabitat@gmail.com, or you could get it from Lauren or even Diane at the Senior Center has it. You know, hopefully Zoom can be a tool that we as seniors can use to check in with each other for a long time. And, you know, I think that's a good idea. A lot of seniors are starting to use Zoom now. And so I'm just hoping that that's something we could latch on to and kind of help ourselves.
Yeah, Ruby, I think that's so great. And that's exactly one of the things that I think is actually, if I can even say it, a blessing out of this COVID thing, that we're all learning to that we can still stay in touch afterwards. And I think it's something that will persist in a great way. So that's just incredible.
And also, oh, go ahead.
No, I was just going to say that's really true, because one of the things that we've tried to do during this period of time is to have our seniors get together and come up with their own ways of how they can stay in touch. At our center, different people take the leadership every week to create a walking tour in the Central District. So they gather at our place like 10 o'clock in the morning. They're, you know, masked up and everything. And they just walk around the neighborhood and visit sites and do that as a means of not being so isolated. But that was a member-driven activity that we just helped to share with other members by telling them, and a different senior every week takes that responsibility on. And they want to continue that.
Before I hand it over to Alvin, Robert made a really great comment about the importance of just checking in with neighbors and being present in community. Alvin, go ahead.
Absolutely. Well, this brings us to a close. This has been a very exciting show for us. We talked about unemployment, rent resources, the eviction moratorium, mental health, and seniors in isolation. So we'd like to thank all of our guests for being a part of this conversation. And yeah, Laura?
And we want you to be a part of the conversation as well. So just remember that this has been created for you and about you. So our next community conversation is planned for Wednesday, January 13th, the second Wednesday of January from 6 to 7:30. And we look forward to seeing you again then. And feel free, please email us with topic ideas for the 13th or anytime next year at our email address, don_cec@seattle.gov. So I'm Laura Jenkins.
I'm Alvin Edwards.
I'm Osvaldo Hernandez from the Department of Neighborhoods. Thank you, everyone, for joining the conversation, and have a great evening.
Thank you.
Thank you, Ruby.
Thank
you, Ruby.
Thank you, Ruby.
Thank you. Bye. Goodbye, Mitch.
Thank you, everyone.
Bye-bye. Thank you. Bye-bye.
Thank you,
If you have any questions, feel free to put them in the chat, and then we'll follow up with if you leave a contact info as well. Bye, Luisa.
Bye-bye.
Is there a way to save the chat? I don't know WebEx. Is there a way to save this chat?
I believe you cannot. Is that right, Jean? Do you know we can save the chat?
I think we can save it, right? Because I think from the previous ones, Suzi was able to kind of go through, I think, and
maybe it's part of the recording.
I think so, yeah.
Copy it. I'll copy it just in case and paste it somewhere else so we have it. But Mitch, if you need any portion of it, just let me know.
Okay. That's a great idea. Thanks. Just incredible. Thank you so much for being invited and being a part of this. And Diane, I love getting to meet you. We haven't gotten to work together yet, but I know we will.
Okay, that sounds good. I look forward to it, Mitch. You take care. Everybody.
All right, look at us. We're connecting people. We love it.
Thank you,
Thanks,
Diane.
y'all. That
Thank you,
was awesome.
Mitch.
Thank you, Robert. Thank you, everyone.
Bye.
Thank you.
Okay.
Thank you.
Good night.
Bye, everybody.
Good night. Bye-bye. Bye-bye.
Bye, Lisa.
Are we going to stay on?
Yeah.
Or, okay.
Let's just stay on briefly.
Thank you, Jean.
You're welcome.
Of course.
Yeah,
I don't know.
I think you used to be able to save the chat individually, but I couldn't find it.
Yeah, I thought that Suzi was able to do it with one of our previous conversations, if I'm not mistaken.
Switch out, yeah.
I know that
it does show up in the
captions.
Yeah, and then, so I think that's what it was. I think it was the captions.
Oh, was it the captions? Okay.
Mm-hmm.
So I'm going to email it to myself. I'll email it to both of you guys too, just in case.
So if you click on open chat, what does that mean? It's interesting. Oh, I thought you could remove people, but you can't. Okay, well, thank you again, everyone. You did a good job. I'm gonna go have dinner.
Thank you.
Do you have any questions, Laura?
No. That's everything. No, that was really this one.
I thought that was
all the topics were so good.
Mm-hmm.
Yeah.
Great
I also thought it went really well. I thought it was
Yeah.
I thought it was very good. Mm-hmm.
Conversation.
You're right. I really did feel more conversational for sure.
I agree.
Yeah, less. We didn't do a lot of thank yous at the end, so that helped a lot, I think.
And the chat was popping off this time too, which
It
was
was,
nice.
Yeah,
Very
we
well
kind of
said.
also almost needed a little chat assignee.
I know.
It's okay. We survived. It was perfectly fine, actually.
Yeah.
It was lots of information. Yeah, it's great.
Yeah.
Yeah.
Well, call-in user number 9 and Kevin Cox. Have a good night, everyone. I'm logging off.
Have a good night.
Bye.
Bye.